Welcome to Sex at 10. I'm Rebecca Rosenblat, certified relationship and sexuality therapist and your host, here to answer your questions on all things intimate. Whether you're stuck in a relationship dilemma, have issues with your body, trust, trauma, addiction, orientation, or just need a little help with turning up the heat in your bedroom, give us a shout at 1-800-968-7836 and let's chat. Everything's fair game. If you've thought about it, we can talk about it. Let's begin with a discussion on how depression impacts relationships and intimacy. And to help me with that, we're being joined by an expert in the area, Dr. Ari Zaretsky. Dr. Zaretsky is the Chief of Psychiatry and the Vice President of Education at the Sunnybrook Health Sciences Center. He's also an expert in cognitive behavior therapy, a highly effective and scientifically validated treatment to address many mental problems, including depression and anxiety. Beyond that, Dr. Zaretsky has a special interest in teaching and education, and indeed deserves major kudos in both. Naturally, I'm truly honored to be presenting him to you tonight on Sex at 10. Welcome, and thank you so much for joining us.
Thanks for having me.
Really appreciate you taking the time at an ungodly hour.
Yes, my pleasure.
But looking forward to a really important discussion with you tonight.
It is a very important issue, I think.
It certainly is, and you're doing a lot of stuff in mental health work, so I'm very excited that you've taken the time to cover this. Dr. Zaretsky, perhaps you could begin our discussion by highlighting some of the key traits of clinical depression.
So depression is a really common condition, as you know, and actually in Canada, there are about 3 million Canadians that are suffering from depression.
Wow.
So it's an incredibly disabling condition, a common condition, and it really affects 3 different areas, I would say. So one is it has an emotional effect. And so people often think about depression as sadness, but it also can be irritability, it can be anger, it can be anxiety as well. In addition to that, there is problems with the way that people experience things like sleep and appetite. So there are physical effects from depression as well. People have effects like sleeping too much or sleeping too little. They have insomnia. They have either low appetite or they have increased appetite.
Either end of the spectrum, and sometimes just loss of interest in things that previously interested them.
That's right. They have a decrease in their ability to experience pleasure, and that's where actually the low libido can come in. They can actually have a lack of interest in sex. So there's those physical effects from depression, and low energy is another example of a physical effect. And then there are also changes in the way that people think when they have depression. So they have problems with their concentration, problems with their memory, problems with making decisions, but they also have negative thoughts about themselves, about the future, about the world. And so it's almost like they see the world through dark glasses. And that can have a devastating impact, obviously, on their self-esteem, can lead to hopelessness, and it can even lead to suicide at times.
Really painful, debilitating condition. A lot of symptoms directly impact relationships, as you're talking about emotions, how they feel about themselves, the world in general. You know, being critical of one's partner, questioning their love, maybe needing a lot of reassurance, yet being withdrawn and disinterested, and so on. Can you please elaborate a little bit more on that, how it affects the relationship?
So it really has a profound effect on the relationship, and for the reasons that you mentioned. So if you break down the different components of depression, so there's the emotional effects. So people are sad, they're irritable. So that leads to difficulties in their interactions. They can be very angry at times, or they can be profoundly sad and unreachable emotionally. They can withdraw into themselves. They can withdraw from friends. So that's one of the effects of depression.
It's brutal for the partner.
It's extremely difficult, and many times the partner doesn't understand and can blame themselves, or they can get very angry at their partner who has depression and think that, you know, what's wrong with you, pull yourself up by your bootstraps.
Oh, that's so brutal, because people really do think that. Some people end up personalizing it, and others will say snap out of it, and it's ridiculous. They have no understanding. So I always tell partners, you need to do a little bit of research, maybe sit down with the doctor, with your partner's doctor, and know that this is not something where they can just snap out of it and not to be resentful.
Exactly, exactly. So it can have those effects as well on the physical component. So the low libido is a symptom of depression, which obviously can have a big impact on the relationship. It can lead to a lot of frustration, a lot of anger, a lot of resentment.
Right.
But there's also other effects. So because the individual has a negative view of themselves, negative view of the world, negative view of the future, that can also lead to a lack of interest in intimacy, lack of communication, and that in turn can have a devastating impact on the relationship and on sexual intimacy. And then the other part of it is that many people with depression also try to cope with depression, and so they sometimes will resort to things like using drugs or alcohol, which in turn can have a negative impact on their sexual functioning and on intimacy. And then finally, the medications that we use to treat depression, the antidepressant medications, some of them have sexual side effects, and some of the most common ones, the ones that affect serotonin, so the serotonin reuptake inhibitors, which are really the SSRIs, the SRIs, these are the most popular antidepressants because they're very safe, but they also have their own side effects, and one of those side effects is exactly that. It's the fact that it affects libido. It also affects the ability to experience pleasure during sex, and it can either delay orgasm or it can actually lead to no orgasm at all. And so again, the treatment of depression can actually cause more difficulties in the relationship.
And I've had so many people, as I'm sure you have as well, who say, okay, the medications, they've made me feel better. So I actually want to be engaged with the world, but now I can't enjoy sex. And it's really kind of a catch-22, because now they are interested, but nothing is happening. But in some cases, I mean, it's worse than that. The desire is gone. And like you said, it can make, physiologically, it can make sex challenging, especially as far as orgasms are concerned. According to Stats Canada, 8% of Canadians will experience a major depression in their lifetime. So viewers, if you're one of those people or have a partner who is, tonight's a great night to get those intimate questions answered. So please don't hesitate to call in. Let's discuss each of those aspects next that you've mentioned, the interest, desire, arousal, etc.
So what do you want to talk about?
In particular, when you're talking about the interest is impacted, is this something where other medications or some other therapies can work with them? What do they need to do when they've lost interest? First of all, it's important for them to talk to their doctor, talk to their partner. What else do they need to be aware of when they've lost interest?
Well, I think that it's really important to try to diagnose what's going on. And as a psychiatrist, what I would do is I would ask them when the lack of interest began, because many times they might blame the medication as the cause and the culprit of their lack of interest in sex. Sometimes that can be the case. As I mentioned, there are studies that show that sometimes 50 to 80% of patients who are taking SRIs can have some degree of sexual side effects. That said, there are patients that have had problems with their desire that predate the taking the antidepressant, that actually even predate the depression itself. And so you need to really have an understanding of the timing of when this began, what were the issues in the person's life that led to the difficulties. The other thing you have to rule out is whether there are physical issues, so medical conditions. So, for example, if a person is hypothyroid, they have low thyroid hormone, that can actually have an impact on their interest in sex or sexual functioning, all those kinds of things. You wouldn't want to overlook those kinds of things because you can intervene and you can really change things in a dramatic way through some fairly simple maneuvers. So you want to really make sure that you're doing a thorough, comprehensive assessment of the person, ruling out the physical conditions that could contribute or even cause the lack of desire. And then you can come to some conclusions. For example, if it is the depression, in fact, that's causing the difficulty, then you want to treat the depression. And in the course of treating the depression, you may also want to start addressing the relationship issues. There are studies that actually show that people who are depressed in the context of an unhappy relationship actually benefit from their depression if you treat the relationship.
So you would recommend couple therapy at which point in treatment?
So again, you have to personalize it to the individual. Some people are so depressed they can't participate in couple therapy. They don't have the energy, they don't have the concentration, they're too depressed. So you really have to bring them out of their depression sufficiently so that they could participate. But if you see that after treating their depression, the couple issues are still there, then I think it's appropriate to actually refer patients for couple therapy. And I do that very often, actually, in my own practice.
You do couple therapy, or you refer people?
I refer patients generally because I think it does require a certain level of expertise. I do often bring in the other person in the relationship to a session with me to understand the issues from their perspective, to educate them about depression, to really get their perspective on the difficulties so that they're more engaged in the process and then they can participate in the couple therapy more effectively.
I think that's a really valid point. I do a lot of couple work, and I've noticed that one party, generally the depressed party, or whatever else their ailment may be, if they're not in a healthy place, they simply can't participate, and their partner gets very, very upset because they sort of think this is the last resort. I brought my partner here, and often they do drag their partner in when they don't even feel like they're ready, and it's like kind of fix them, and they don't realize that it's a couple issue. It's the dynamic, it's the interplay between them. So I think it's a really valid point to wait until there's sufficient mental health to be able to at least appreciate and work on couple work. And lots of people, they'll end up saying, you know, when they get better, that this was, in a twisted sort of way, it's the best thing that ever happened, because now we actually put our relationship back on track, and it had been kind of getting eroded over time. So really valid points. Viewers, if you're struggling with any of these issues and have a question for Dr. Zaretsky or myself, please call in right away. It's a great way to get expert advice. What you've discussed is complicated, since there can be multiple factors interplaying in myriad ways. So indeed, it's crucial for one to have that proper discussion with their physician. And you were just talking about some of the ways that you need to tease apart what's going on. Sadly, too many people don't do that, or they don't have the language to do that. So can you maybe briefly comment on how to get that conversation started with your physician?
That's a great question, Rebecca. I guess what I would say is that people have to recognize that these are common problems that occur in depression: the lack of intimacy, the lack of sexual desire, and if they are aware of that, they might be more inclined to have an honest discussion with their physician. And also, if they recognize that the medications that they're taking for depression might actually have side effects that impact on their sexual functioning, then hopefully they will be more assertive in talking about these issues, not embarrassed, but actually... Not embarrassed, yeah. Yeah. Because
lots of times they'll say that my doctor never brought it up, so I was too embarrassed to bring it up myself. Viewers, if you have any questions about the subject matter or sexuality in general, call us right away before Dr. Zaretsky leaves. Now, one of the amazing things nowadays is the variety of treatments that are available, including you know, all kinds of therapies. You do cognitive behavior therapy, interpersonal therapy. Can you talk about that a little bit, please? Because it's not just about the drugs with the heavy-duty side effects. Do you use those in conjunction? What do you do there?
So I believe that for many patients with depression, they can benefit from psychotherapy, and there are various forms of psychotherapy. I wouldn't say that there's one form of psychotherapy that has a monopoly on treating depression, but I do think that it is important to think about psychotherapy. For mild depression, I think that you could treat it with psychotherapy alone and get very good outcomes. Unfortunately, it's not always available. Sometimes it can be very costly for the individual. So I do think that a person has to advocate for themselves and understand what the resources are in the community, and also assert themselves with their family doctor to really be referred to an appropriate psychotherapist who has the expertise. For moderate to severe depression, I think that often a combination of medication and psychotherapy is in order. And I would say that the psychotherapies that have a lot of empirical support are these time-limited psychotherapies that are very focused on the here and now, on problem solving. They need to look at. Thank you so much. We really, really appreciate you taking the time tonight and talking about some really important stuff. We'll be right back. Keep your calls coming, and let's discuss sex, relationships, romance, or whatever else rocks your boat.
And keep it locked on Rogers TV because we have lots more great stuff still ahead, including your calls. So pick up the phone and call so we can connect.